I get a lot of patients who tell me their shoulder keeps popping out. What happens with shoulder instability is that the ligaments in the shoulder, the structures deep down inside, that's underneath all the muscles, hold the shoulder joint together. When these ligaments are torn, and they can tear from trauma or other injuries, they then render the joint unstable and the shoulder will pop out. It will become dislocated or become unstable. This is a right shoulder model that you're looking at. And in this model, the ligaments in the very front are torn. Because of that, I'm able to dislocate the shoulder and pop it out of the joint. We refer to this in the medical profession as shoulder instability or shoulder dislocation. So what are the treatment options for a shoulder that dislocates or pops out? Initially, you want to be placed into a sling to let the soft tissues heal on the inside. And we'll do that for about 2 to 3 weeks. Once that period is over, physical therapy will be the next step. Therapy is meant to strengthen the surrounding tissues, muscles, tendons, to keep the joint from coming out again. If those don't work or they fail, the next step may be surgery. In a case where surgery is required, one of the things that can be done is reattach the ligament back down to the bone. This is a left shoulder model that you're looking at, and the ligament in the front has been torn. The most common spot for the ligament to tear is in the very, very front, off of the glenoid or off of the cup. What needs to be done is this ligament needs to be reattached back down to the bone. So what I'll do is I'll prepare the bone around this area, and I'll then place an anchor, which is a small metal screw, if you will, which has a suture attached to it. This is placed into the bone, into the spot where I want the repair to be made. Once it's in the proper position, I'll pull this device out, and it leaves me the suture then, which is passed through or woven through the ligament, tied back down to the bone. And that is one of the ways that the ligament can be repaired. I hope this information has been useful for you. The next step, if your shoulder keeps on dislocating or popping out, is to go see an orthopedic surgeon and find out what the best treatment options are for you.